All right. Well, my name is Lisa Stokes. I want to thank all of you for joining us today. I'm very excited to introduce this 8-week virtual series that we worked so hard to put together for you. We put a lot of hard work into it, so we're ready to roll it out and see what you guys think. So here we go. As we get started, just want to tell you a little bit about myself. I've been with WellSpan for 8 years, working as a physical therapist assistant in outpatient rehab. I'm also part of the WellSpan Sports Medicine Group, which is why I'm here today giving this introduction. The pandemic that we are experiencing now as a country, state, and county has affected all of us individually and has provided us challenging ways to be more creative on how we can reach out to you in the community. We have put together a small group of diverse, experienced, and motivated individuals to continue to make a difference, be available, and help those like yourselves. Our goal with this series is to support you as coaches during this pandemic by providing education and resources to help you stay active, take care of your body and mind, and prepare for upcoming seasons and prevent injuries as we begin to do more. Today, I have the privilege of introducing our guest speaker. Her name is Beth Conway, and the target topic for this week is nutrition. Before I let Beth take over, I just want to give you a little background on Beth. She is a clinical dietitian providing outpatient medical nutrition therapy. She has been working in the field for 26 years and has a Master's of Science degree and is a licensed dietitian and nutritionist. Beth is originally from New York City and has moved around to Indiana and Pennsylvania. Beth has worked for WellSpan for 17 years and is currently working out of the office in the Queensgate Shopping Center. What interests her the most about sports medicine is working with student athletes and helping them to realize the impact nutrition has on their performance. Beth enjoys running and has done 2 full marathons and over 15 half marathons and numerous other races. There are times that she's planned vacations around her races and calls them runcations, with destinations like Corny, New York, Cincinnati, Ohio, and Rehoboth, Delaware. Beth is also a Penn State fan. Before she gets started, I just want to address a few housekeeping items. We'll have the question and answer at the end, and you can participate by submitting the questions throughout the presentation or waiting until the presenter is finished. If you have not done so already, please mute your computer. And for security purposes, the host has the capability to unmute the participants as needed. So Beth, if you want to go ahead and take over.
Great, thank you for the introduction. I appreciate it. And thank you for having me to speak to everyone today. I hope everyone is enjoying the nice summer weather we're having. I was asked to speak about nutrition, which is always an interesting topic because for you as coaches or even any physicians on the line, if you're asked to speak about medicine or if you're asked to speak about lacrosse, you know that it's a very broad topic. So I could be here for hours, and I promise you that we won't, but I can be here for hours talking about nutrition. But I thought I would try to get a little bit of a focus and talk a little bit about some sports nutrition myths and maybe try to get some more truth into these. A lot of the items that I'll be discussing are things that I've heard from other athletes that I work with, as well as coaches along the way. One thing to keep in mind as we're going through, and you're going to hear me saying this several times, and you're probably going to hear me saying a lot of different themes several times, but one thing to keep in mind is that each athlete is different. What I'm trying to provide nutrition-wise for maybe a 13-year-old track athlete is going to be different than the 18-year-old male who's playing football. So what I'll be talking about is in more general terms, but we do need to remember that every sport's different and every athlete is different as well. The key word is trying to individualize. And that's one thing that I do in my own practice when I'm working with teams or even individual people, is I have to keep that in mind, is that each person is individual, and I do have to remember that and adjust, because everyone eats differently and everyone has a different history in terms of their eating and food preferences and so forth. And so that's what I try to do with each person that I'm working with. I thought I would start with some protein myths. These are some things that, again, I said I've heard from several different athletes along the years. The more protein you eat, the more muscle you'll gain. Protein supplements are going to build bigger muscles. Protein is all I need as an athlete. Vegetarian athletes can't get enough protein. And I need to use protein powder to get my protein in. Keyword is need, or all that an athlete needs. In reality, though, we know that actual protein needs, there is a range. Now, for a typical athlete, age 13 all the way up to low 20s, they are going to have very basic needs. Anywhere from 1.2 to 2 grams per kilogram is an example of what their protein needs might be. I will show you a more specific example than this. Another piece that goes along with this is that it's not just protein that's going to help them from a performance standpoint. It is remembering that balance is key. And one thing I often say to my athletes when I'm talking with them individually is that trying to meet needs with real food, you get more bang for your buck. Not that there's not a place for the protein powders, because I have a lot of athletes who like to use that. They're convenient, they're easy, they can be quick, they can be portable. But I also talk with them about trying to use real food sometimes to get more bang for their buck. For example, if they're just using a basic protein powder, that's one thing. But if they're getting the protein from something like meat, they're also getting a lot of different nutrients along the way. So again, getting more bang for their buck. I do tend to see some athletes that are vegetarian, and there are varying levels of what that means. But certainly someone can be vegetarian and get their nutrition needs. It can be fairly common for someone to come into my office and tell me they're vegetarian, and mostly what they're eating is a lot of just bread. And there's not a whole lot of variety in their diet. But as you may know, there are lots of different vegetarian sources, such as things like beans and lentils, tofu and soy, dairy, nuts and seeds, quinoa, and eggs, among other things as well. I popped up here an example of that 1.2 to 2 grams per kilo of protein. So if I have a female athlete who's about 5'6" or 130 pounds, they're going to need about 71 to 118 grams a day. If I have a male, and yes, I know that we can have a large range in terms of height and weight, I try to go somewhere in the middle. If I have a 5'9", 175 pound male athlete, his needs will be somewhere around 95 to about 160 grams per day. Now, what does that actually mean? Okay, what does this look like? If I look at that female athlete, I can meet that very easily with food. So breakfast might be some eggs with avocado and toast. Lunch might be a wrap with some yogurt and fruit, maybe a little granola bar, some nuts for a snack, some meat, rice, and broccoli for their dinner, and maybe a glass of chocolate milk post-exercise or post-activity. If I have that same male athlete, with his needs being a little bit higher in this example, you can see that I still was able to meet his protein needs with just food. And by adding an extra snack in or some larger portions and slightly more variety in this example, I was able to meet his protein needs with just food alone. Probably one of the hot topics, and quite honestly, with everything that I bring up, I can probably talk for a long time about each topic, but I'm trying to just give you a nice overview of each myth and some truths, is some carbohydrate myths. Some carbohydrate myths are things like, excuse me, athletes should avoid carbs and sugars. Eating carbs can make an athlete gain weight, or even carb loading always improves performance. And again, keyword is always. Now, the carbohydrate reality is that carbs will provide energy that the athlete needs for endurance and strength. Carbs will also help athletes reach their optimal performance levels. And we know that when someone is fueling appropriately, that's going to help performance. The key thing with carb loading is that the old adage was that the night before, if you ate lots of pasta, for example, or lots of carbohydrate, that's going to help you for the next day. And now we know that that's not really so much the case. The key is, what are you doing maybe days or the week leading up to it, so that you can really focus on what's going on along the way and feeling your body along the way versus what's happening the night before. That single high carb meal is not necessarily going to be as effective for boosting the muscle glycogen levels. And really, quality does matter, which I will talk about a little bit more too. When it comes to that carbohydrates, you have to think about what's really important. Yes, trying to make sure you're getting nutrition, but the training, taper, and rest days are helpful. One thing I always tell my athletes, carbohydrates or not, is not to try anything new. So if they never really ate a very large meal the night before a big event, they probably shouldn't start now. And then sometimes eating, when I say all the food or eating lots of food, might actually have a negative impact on their performance, because it really might bother their stomach. So that's something that's going to be significant for them to remember too. I think the one key thing to remember when it comes to carbohydrates is that we can talk about this a lot, as I said. And again, if we refer back to that individual piece, what we're talking about right now are ages, 13 up to low 20s. Many of these males and females are still growing. Some may or may not have gotten a period yet. So we need to remember that they need variety in nutrition to help with their performance. And that's something that's going to be key versus trying to restrict or trying to limit what they're eating. There can be a place for lower carb. I have worked with some athletes here and there. I don't know if any of you are runners or there was just recently, I had a name written down here, Michael John McKnight, if that's a name that's familiar to you. He just did 100 miles. He's an ultra runner with no fuel. So yes, it can be done, but with the target audience that we're discussing today and the young athletes we're discussing today, I do emphasize balance and quality in getting their nutrition in. So if we kind of shift gears just for a minute, we think about, okay, you're talking about balance, you're talking about quality. What does that really mean? What does fueling actually mean? And so these are some of the guidelines from the American College of Sports Medicine, along with the Academy of Nutrition, that look at what are some fueling basics. So generally speaking, fueling basics include looking at what are they having before the activity. So the recommendation is to try to include some sort of carbohydrate-rich meal or snack to increase that energy availability and sort of help with post-exercise recovery. I'll talk about timing in a moment. I also encourage including some small amounts of protein, if possible. And then just keeping in mind the fat and the fiber. Not everyone reacts the same, but sometimes those foods that are higher in fat and fiber can potentially be a tolerance issue. So we look about before activity. If I have someone who's eating maybe an hour to 4 hours before, then we're looking at something that's more of maybe a mixed meal, as I had mentioned. So it could be something that has a little bit of protein, a small amount of fat, and also some carbohydrates. So there are some examples listed there. Things like oatmeal with some nuts and fruit, cottage cheese with some yogurt and fruit, maybe a burger or some chicken on a bun, or some sort of sandwich with fruit. If someone is grabbing something quick and it's a lot closer to exercise, they're not really going to want to have something maybe so large. That might not go well with them just starting their exercise or activity or their practice. And so these are some examples of ideas that you might try to have before activity. So typically speaking, we try to stay with a little bit lower fat. We might stay with a smidge or no protein and just give something that's going to be a quick example of energy. Some other fueling basics during activity is I always encourage them to start with a full tank. One really great example is that if I have an athlete who maybe has an early lunch at school, say their lunch, I think some of the early lunches lead to, let's say 10 o'clock, 10:30 in the morning, and then they've got a practice or a game, are they bringing a snack with them? Are they bringing something with them that they can have before their performance so that they are going to be starting off with a full tank versus not having anything and trying to rely on what they had at 10 o'clock that morning? And also fluids are going to be important. We want to make sure they're preventing dehydration. I will talk about fluids as well. During activity, and I know many of you on the sidelines have some sort of sports drink that some of your athletes will use. But for something that's lasting more than 60 to 90 minutes, typically speaking, there is a recommendation to not just get hydration and some electrolytes, but also potentially get some sort of fuel as well. And there are some examples that are listed here. After activity or recovery is something that I think oftentimes will get lost in the shuffle when it comes to our student athletes. They get out of a practice and they, get caught up on their phone or catching up on their social media, or think about the homework that they have to do, and they don't really think about how to recover from a nutrition standpoint. And it's important. We have the R's of recovery. We've got to restore. So any kind of sweating during activity, it's important to restore the fluid and electrolytes that's lost. It's important to replace the muscle fuel. So having that carbohydrate to replace that glycogen that was burned during exercise. And also repair. So trying to include some protein to help promote muscle and muscle growth and some of that repair of those muscles. Some ideas after a workout might include some quick items. So if it's someone who's maybe not going to have a meal right away, for example, these are some small little quick things that they might have, or say like a trail mix that they might have in their backpack. That would be an option right away after a practice. Or if they're going to have a meal when they get home, again, it's a nice combination of that protein that I mentioned before with a little bit of carbohydrate and some fat. So for example, the rice bowl with some beans and cheese and salsa, maybe a little bit of avocado with a lean protein like chicken. One of the questions I often get is, well, when is the right time to have something after exercise for maximum recovery? And the strong recommendation used to be you have to have something right away. And it's nice to try to have something within about 45 minutes, but the window doesn't totally close. So as long as they're trying to have something within a couple hours, that's something that's going to be reasonable. If it looks like it's going to be a while, like if it looks like it is going to be a few hours, then I will suggest that they have an extra snack in their backpack or a cooler bag so that they can have something when their activity is done. There are also some hydration myths. So things like, I've heard a lot of athletes say that they don't like to drink a lot because fluids during exercise will slow them down. They say, well, I'm not really thirsty, so I don't really need the fluid. I'm doing okay. And also sometimes I've heard people tell me that sports drinks are really not a good option. So some hydration truths. If we think about what are some goals of performance hydration, we know that it's important to be hydrated because you're going to get good performance by making sure that you're hydrated well. It's also going to be helpful to provide recovery. So again, if you're not hydrated, that's going to have an impact on recovery afterwards. And it potentially will minimize injury and muscle cramps. So those are also going to be important as far as hydration is concerned. What are some consequences of dehydration? Increased temperature, heart rate, nausea, fatigue. So even something as basic as fatigue, that could be affecting their performance. Headaches, muscle cramps, and their performance will decline with as little as 2 to 3% of a decrease in their body weight. So it doesn't take a whole lot to really have an impact. In fact, if I go back to that 130-pound female that I had before when I was showing you her protein, that's only about 2.5 pounds of a decrease. And that's not a lot. That's something that, if she lost any more than that during activity, or that's going to definitely affect her from a performance standpoint. So how much fluid is recommended? Ideally, 2 to 3 hours before, trying to take about a 1 water bottle full. So a typical 16-ounce water bottle. About 15 minutes before an activity, if you're unable to get it, about 8 ounces. That doesn't mean that they need to be chugging their water. The idea is that hopefully that they have the water with them. I know some schools will allow students to have their water bottle along the way in their classes. So I do encourage students to do that, athletes to do that if they have the ability to do that. During their activity or during exercise or during the event, 4 ounces of fluid about every 15 to 20 minutes, which can be hard to get. And so that is a recommendation. Many times it's difficult to get that. And sometimes when I talk to student athletes in groups, I'll grab a little Dixie cup. And again, if any of you are runners, you've gone through the water stations where they've given you the Dixie cup. And I'll say, every time you take kind of a gulp, you're getting about an ounce or so. So if you're taking 2 to 3 large gulps, you're probably getting what you need during that time frame. After the exercise or activity, the recommendation is about 16 to 20 ounces of fluid for every pound lost. Now, you might say, well, we don't really know how much weight we're losing or gaining, and that's not necessarily something that the students have to do. But again, as a general overview, trying to get at least another water bottle afterwards is going to be a good step in the right direction. Some professional teams will even do sweat rates, and they'll weigh them before and after and kind of assess their nutrition needs and their fluid needs that way. So not necessarily something that we have to do here, but I think it's important just to encourage the kids and the athletes to make sure that they are indeed getting the fluid that they need. As far as sports drinks are concerned, when I talk about those with the athletes, I do encourage them to use them for what their intended purpose is. So if they're going to be exercising for more than an hour to an hour and a half, there is going to be a role for them. If they're trying to use sports drinks just to sort of drink as a random drink or just have as another beverage, I do try to discourage that and really try to keep it for what it's intended. I also remind them that energy drinks are not examples of fluids that they should be using to depend on to get the fluid in that they need for their best performance. Another myth sometimes that we see are adjustments in the diet. So maybe they saw something on social media or someone told them to make these adjustments in their diet to try to help improve their performance. So for example, they might have been told, hey, go gluten-free, or avoid dairy, or don't eat any fat, or really limit your fat, or you have to eat less to lose weight, or they're told that they need to lose weight right now. Now, there is going to be room for restriction. You know, I might have someone who does have some individual needs. Maybe they have celiac disease, or maybe they have irritable bowel disease, or IBS. Or maybe there are some foods that truly are going to be an issue for them before their activity. So if they do have celiac disease, then yes, they should probably avoid gluten. There's some anecdotal evidence for people that say, oh, well, if I avoid gluten, then I feel better. But there's really nothing scientifically proven that says avoiding gluten is going to help your performance. If they have IBS or irritable bowel syndrome, yeah, wheat and some other foods can possibly be triggers which might affect their performance. It's not the gluten that's found in the wheat, it's the type of carbohydrate called fructan that can be the issue. But there are some things that if someone has IBS, I might talk with them more specifically and try to make sure that they adjust their diet accordingly. And yeah, there are some foods that could be an issue before activity. As I mentioned before, high fiber or high fat sometimes can be a problem. I was actually speaking to a volleyball team a couple years ago where one of the players indicated they were eating a very high fiber bar prior to practice. And her teammates would always tease her because she was passing gas all the time. And when she actually realized that it was the high fiber bar that was potentially causing her that issue, she stopped. We talked about ways to switch to a different item before her practice, and she didn't have that issue anymore. And she realized that she was doing a little bit better because she wasn't even feeling as bloated. So the thing to remember is, does that really mean there should be a blanket recommendation to avoid food groups? You know, hey, don't have wheat, or hey, don't have dairy. The answer is no. Because if you think about it, if I tell someone, hey, don't eat any dairy, you have to think about, are they getting their calcium, their vitamin D? Do they have an alternate protein option? If I tell them to avoid fat or not eat any fat, are they getting enough calories? If they're very, very low fat, are they getting enough to help absorb their fat soluble vitamins or vitamin A, D, E, and K? If they're overly restrictive, which we'll talk about soon too, are they even getting their essential fatty acids that they need to get from an outside source? If they've been told to go plant-based, are they doing this in a healthy way? We did say earlier that someone who's vegetarian can get protein, but if they are just randomly going plant-based, are they getting their protein? Are they adding in iron and zinc sources? What about their B12 if they're vegan, or calcium and vitamin D? If they stop eating gluten, are they getting enough nutrition for fuel? Are they getting their B vitamins or fiber? If they've been told to lose weight, what is their overall nutrition adequacy? What about their physical performance or even their mental performance? Because if they're not taking in enough, that's going to affect them mentally as well. The key thing to remember is that if you have an athlete that potentially could lose weight, during the season is not the time to do it. The off season is the best time to make some of those changes. And lastly, if there's any kind of restriction in general, are they getting enough fuel that they need to give their best performance? So I really like these plates. I think they're a really great visual that's coming from the United States Olympic Committee, sports dietitians, that looks at an athlete's plate on a really hard in-season training day. And as you can see with that balance, you know, a lot of that plate is carbohydrates. We still have our protein, we still have our veggies, but we have a reasonable amount of those quality carbs that I keep mentioning. If we look at someone who's maybe having moderate training, maybe they're not quite off season, but they still need to make sure that they're getting that nutrition. You can see the plate kind of shifts a little bit. So those carbs are still there, but they've gotten that amount on the plate has gotten a little bit smaller. We've increased those veggies. So we're getting more color, we're still getting those nutrients, but we've shifted what that plate looks like. And then last, we've got easy training, or what we might say weight management. Easy training might be something like, say, during the off season. And again, you can see how that plate's going to change. So we've got a little bit bigger amount of protein. We have lots of fruits and veggies. That's taking up most of that plate. And then that carb serving, sorry about that. That carb serving has actually decreased again. So it is a much smaller amount on the plate. One of the examples that I use when I'm talking to the athletes is I'll say, let's talk cars. And this is something you've probably heard time and time again. And some of them have heard it and some of them have not. And they know the comparison between our bodies and a car, and that gas is the fuel that fuels the car. And the same way the food is the fuel that fuels our body. But the other piece that I will take a step further is say, okay, well, if you try to put diesel in your small car, what will happen? And a lot of times they'll know the answer, well, you know what, the car's not going to go. And I'll say, you know what, that's exactly it. So when we are trying to fuel our body, we want to make sure we're putting the right kind of fuel most of the time into our bodies to try to make sure that's going to help us with the best performance. Disordered eating. There's a lot of myths that I think are associated with this as well. And quite truthfully, this is an interest of mine, and this is somewhere where I could sit for a very long time discussing. But some disordered eating myths you might hear are things like body image distortion, that's a women's issue. Or, you know, if someone has really strict rules about eating, that's not really a problem. Or you can tell a person has an eating disorder just by the way they look. You can just see it. Or a lot of female athletes will lose their period, and that's really pretty much normal. If an athlete's performing well, then they must be healthy. And you can never eat too healthy. They're just a very clean eater. So all of those are different myths that I've been told or that I've heard. The truth is that athletes are more likely than non-athletes to have an eating disorder. Some of that is the competitiveness, some of that is that perfectionism. So there's a lot of different things that might account for that. But we do know that athletes are going to be more likely to have an eating disorder. The one thing we don't always think about, though, is that 1 in 3 people struggling with an eating disorder is a male. They looked at college female athletes, and there were about 35% of them were at risk for developing anorexia, and a higher number were at risk of developing bulimia, where they would binge and then purge, not just purge and throw up, but also potentially purge by using laxatives or excessive exercise. But they also found that male athletes were at risk as well. 10% of college male athletes were at risk for developing anorexia, and 38% were at risk for developing bulimia. You know, why do we not necessarily associate with men? You know, we might think, hey, they're just being strong. You know, they're restricting, they're eating so healthy, they're being really, really strong, or they're very disciplined in their eating. But the truth is, some of them can actually be really sick, and it's something to really keep in mind. I'm not sure if there's any fans out there, but maybe some of you recognize this person. And this is Big Toe Joe, Joey Julius. He was the Penn State kicker in 2017, and he was diagnosed with a binge eating disorder and actually did have to leave and went into treatment. He said, I wasn't just Penn State's kicker, I was Penn State's overweight kicker. So I think this is a really good example that it isn't something that just affects females or just affects young people. It's something that can have an impact on even some big names as well. Some of you may have heard of something called the female athlete triad, which focuses on the menstrual function, also looks at bone health, and then also looks at the amount a female is eating. So we've known as the female athlete triad. But that's been expanded to something called the relative energy deficiency in sport, because it does look at both men and women athletes and how their eating can have an impact on performance. So we know that if if they're not eating well, there is a psychological component. Depression, they might be down, that might affect them mentally in their sport. We know that if there's any kind of bone health issues, that might have an impact on increasing injury risk. We also know that if they're not eating well enough, that's going to have an impact on decreased concentration, which is going to affect them from a performance standpoint as well. So it's not just, is my athlete, my female athlete, getting their period, or are they not? But it's a much broader picture that we know of. We know that someone can be diagnosed with an eating disorder, even if they're still getting their period. And as a side note, we talk about this from an eating disorder standpoint, meaning they have anorexia or they have bulimia. But there's also something on the flip side that is just noted as disordered eating, which can have an impact as well. So maybe they don't have a label on it, or they haven't been officially diagnosed, but that disordered eating is something that can really have an impact on them from a performance standpoint as well. You may have heard the term orthorexia, and I did want to mention this. Orthorexia is what we call the preoccupation with healthy eating. So, people will eat healthy, and that's okay, but some people will take it to the extreme. They're very fixated on what they're eating. They have sort of a righteous attitude towards food. They look at what someone else is eating and they say, I can't believe that they're having that. Or why would they even think about putting that in their bodies? That's so terrible. I'm so much better than they are. What are some risk factors or some things to think about when we're thinking about our athletes? Are they eating foods at team meals? So if you're having any kind of group meals or team meals, do you have an athlete that might not necessarily be joining in? Or maybe they brought their own food for reasons other than for allergies or tolerances. Do they avoid eating with people in social situations? Do you have a group of athletes that went out and maybe grabbed something to eat, but someone didn't go? Was that a food restriction reason? Are they starting to reject foods they used to love? If you always saw someone eating a specific food and all of a sudden they're not eating it, maybe for reasons like, oh, that's a bad food, then maybe that's a factor. Have you heard any expressions of guilt if they're straying from their diet? Are they that rigid that they can't go out of that box? Are they exercising or restricting more if they felt they had a bad day? So again, it's not just restricting food, but are they over-exercising? Are they judging others? And I kind of gave an example of that already. Or are they expressing feelings of guilt? So how do you know if you should be concerned about your athletes? Some other things to think about. If you're seeing a decrease in their concentration or energy levels, speed, coordination, you can think about nutrition. If it seems like there's a longer recovery time or things aren't healing as well, that might be a concern. If there's some unexplained injuries or stress fractures, I have had several athletes that are referred over to me because they've been identified with a stress fracture or some sort of injury. And then we find out later that they really weren't eating very well. So I have a chance to work with them. Are they always cold? Are they someone who's always saying they're very, very cold all of a sudden? Is their mood changing, or do they have a change in mood other than what's usual for them? Are rest days or a taper very difficult because they want to go, go, go? For some people that they do that, but for others it might be that concern about not being able to restrict from an exercise standpoint. Have there been any recent changes in food habits that you notice? Like, do they always have certain items on the bus and all of a sudden that's really changed and they're not having any kind of snacks on the bus? Are they preoccupied with food? Do you see them tracking what they're eating and really counting things to the calorie? Are they avoiding water and avoiding hydration? So it's a very hot day and they really should be drinking something extra. Are they totally avoiding that? And are some other athletes on the team reporting concerns? They will probably see it potentially before you do as a coach, and you want to make sure you kind of take into account what they might be telling you and potentially have a chance to talk with the athlete of concern. We always focus on winning, and yes, that's important. I've had several athletes in my office who excel at what they do, but are extremely underweight. Females that have not had a period ever or for months and months. And I guess my thought is that's great that they're doing so well now, but where are they going to be in the future if that's not addressed now? I have a client that I've been working on and off with for about 10 years and has qualified for one of the big name marathons. And right now, even though they were a runner and doing a great job in high school, they're not in any position to be able to do that now. So yes, it's important that they're doing well and they're excelling, but we also want to look at that bigger picture and make sure that they are healthy and try to address some of that as best as we can right away. I have several resources here that I have listed, and it's something that I can forward as needed. I'm hoping I can pop a couple up. One is so bear with me if you will. One is the National Eating Disorder NEDA. They have a great coach and athletic training toolkit. I'm gonna slip down here to the table of contents. So they give you lots of information about eating disorder signs, a little more expanding on what I was talking about, potential role of the coach and how to intervene in a positive way. Some common myths and frequently asked questions. And so this is a really great resource. That's a nice option to take a look at if you have time. Another resource I wanted to try to show you is, this is SCAN. So this is the sports nutrition wing of the Academy of Nutrition and Dietetics. And one of the reasons I thought I would pop this one up, see if I can find it. Oops. Okay, maybe not. There we go. Educational resources. They have some fact sheets and articles. But they have all of these resources are great, reputable places to look if you want more information about nutrition and sports. We have the American College of Sports Medicine position stand. We have some positions from the Athletic Trainers Association, some other disordered eating references, as well as websites of some great options, the Olympic Committee, as well as the NCAA, who has some really great information and some nice handouts that can be handed out to your athletes. So, you know, the bottom line is that I've talked a lot about general nutrition today. And as I've said before, things are very individual. Okay? That 13-year-old track star is not going to be eating the same as the 18-year-old football player. And I think that's something to remember. You can get a lot of information, and the athletes are getting it from all over the place, especially with social media. I've actually had some in my office where we've had to look at their Instagram, and we'd said, you know what, maybe you should be following some of these sites because maybe these are a little bit of a trigger for you. So they're getting lots of information. There's some great information out there, and there's some not so great information out there. And I think that that's really important to think about what those influences, what those influencers are telling them, and make sure that it is valid information and not just anecdotal information. And so if you want more, as I've said, I do individualized counseling, and I have come to speak to a variety of different teams at different levels. So I'm available if needed, if you want some more information. And thanks again for having me.
Wow, Beth, thank you so much. What some really great information that you provided us today. Thank you very much. We appreciate that. Dr. Deitch, did you want to say anything?
Beth, I can't thank you enough for leading off our series. You introduced us to the athlete's plate, and you really set the table for our whole well-connected series. You know, for all our attendees, you know, our goal at WellSpan Sports Medicine is to bring together the brightest people in their field and let them do what they do. And Beth Conway just gave a great example of that today in this talk, and I can't thank her enough for doing that. We have a comprehensive approach to treating your athletes and being partners with you, our coaches. Our goal is really to provide that comprehensive care to keep everybody in the game, even during COVID. And in that game, it means being well and fueling the body appropriately. And that's what we're starting with nutrition. It takes a good head on your shoulders. So we want to get everyone's mind right, even though we can't be together in the typical situations we usually are. And we're going to focus a lot also on injury prevention and training, which can be happening right now out of the weight room and away from the fields. And we'll teach you all eat with workouts 2 times a week, 3 times a week for our athletes, how we can get individuals ready for what comes next. Those timelines are not clear at this point, but an off season where we are right now is a critical time to prepare, get better, and be ready to go. So I'd like to open up for questions here also. Lisa, have you take over for a few of those if there are any. We can move on to our next segment. I just say thank you to all of you for your support, and please do not hesitate to reach out to our team if we can help you in any way whatsoever. Thanks.
I currently do not see any questions that were posted. We'll give it maybe another minute while maybe some people are coming up with questions if they have any. I just wanted to review the schedule with everyone so you can stay tuned for the remainder of this series. So it is an 8-week series. We're shooting for every Tuesday is going to be the coaches clinic. Things got a little jumbled up this week just because of Memorial Day. But so all Mondays will, from here on out, hold on, all Mondays from here on will be the athlete education, sorry. And then, so stay tuned for Wednesday, tomorrow at 4 p.m. To get that information. And then all Wednesdays starting next week will be the total body workout. And then on Friday is a focus workout. So we hope that you can join us for that. Some of the other topics that we're going to be covering, like today was nutrition. We're going to do nutrition and behavioral health next week, substance misuse, sleep, active warm-ups and cool-downs, posture, breathing, injury prevention, and then that 8th week we'll just kind of give a wrap-up of everything we did. So that's kind of the rundown of our 8-week series. So thanks again for joining us today. I still don't see any questions. So I think we will wrap up on that note.
Thank you, everyone.
We did unmute you if you guys want, or allow you to unmute. If anybody wants to unmute and ask a question personally, they can.
Hey, Beth, I'm going to ask you, and I know this is an individualized question, but if you had one food option left and you are 3 hours before a race, what would you recommend?
One food option?
One food option.
A smoothie. And we can put everything in and it still counts as one.
That's great. What's in your smoothie?
We can put some fruit, we can put some milk, we can put some yogurt, possibly some peanut butter. Since we're 3 hours before, we have a little space in there if we want to add a little bit of fat, and go from there.
Thank you.
All right, well, I think that's everything. Thank you everybody for joining, and hopefully we'll see you for the next one.
Thank you.